Greetings and good day. Today, PBL 7 will be discussing a case about diabetes among the elderly. So now let's take a look at the case. The case is about a 63-year-old Mrs. J with type 2 diabetes for 20 years, and she was hospitalized due to severe hypoglycemia requiring IV dextrose. She has a history of recurrent mild hypoglycemia with blood sugar levels dropping as low as 2.5 mmol per liter without symptoms. Her HbA1c reading was 6.5% and her blood sugar ranges between 8 to 12 mmol per liter after stopping the dextrose infusion. Her renal and liver function tests are normal and she's planned for discharge from the hospital. Now, what is hypoglycemia? Low blood sugar, also known as hypoglycemia, happens when your blood sugar or glucose levels drops below a healthy range. If your blood sugar drops too low, it can be a dangerous condition that needs immediate treatment. Hypoglycemia is most common in people with diabetes. Taking too much medication, skipping meals, not eating enough, or exercising more than usual can lead to low blood sugar if you have diabetes. Now let's dissect what are the potential culprit anti-diabetic medications that led to her admission. Based on our research, the potential top 2 culprits could be sulfonylureas, which include glyburide, glipizide, glimepiride, as well as glibenclamide, as well as excess insulin. Now let's look at the mechanism of action of sulfonylureas. They inhibit potassium channels on the cell membranes of pancreatic beta cells, causing insulin granule exocytosis. This elevated secretion of insulin occurs independently of the patient's blood glucose levels. Thus, insulin may continue to be secreted despite low serum glucose, making hypoglycemia a major common adverse effect of sulfonylureas. On the other hand, excess insulin administration could have also caused the patient's hypoglycemia. Most of the body's glucose comes from food. The hormone insulin lowers our blood sugar or glucose levels when the blood sugar is too high. Taking more insulin than you need can cause your blood sugar level to drop too low and result in hypoglycemia. Your blood sugar can also drop too low if after taking your diabetes medication, you eat less than usual, or if you exercise more than you typically do, which uses extra glucose. Now, what do you think? What would be your choice of antidiabetic for her? Now, our PBL finds that we can administer biguanides for her. For example, metformin. Biguanides decrease the hepatic glucose production or gluconeogenesis, and it does not stimulate insulin secretion as well, which can reduce the HbA1c levels by up to 1.5%. We should also know that biguanides or metformin is the first-line drug for type 2 diabetes mellitus. This slide shows the mechanism of action of biguanides. Another option that we can administer to this patient would be DPP-4 inhibitors, for example, sitagliptin. This is an incretin mimetic drug and it lowers the HbA1c levels by 0.5 to 0.8%. It is efficacious and safe in the elderly and all stages of diabetic ketoacidosis as well. This slide shows the mechanism of action of DPP-4 inhibitors. So what is our justification for administering these drugs? Let's have a look. Metformin. Metformin is a first-line drug. It is safe and affordable. It also serves as monotherapy. It is cardioprotective as well as reduces the hypoglycemic risk of the patient. However, it has adverse effects such as it can cause GI or gastrointestinal symptoms. It can also impact the patient's renal function. Now let's have a look at DPP-4 inhibitors. DPP-4 inhibitors will lower the hypoglycemic risk, which is great. It also has no GI symptoms as well as serves as monotherapy or in combination with metformin. So our choice is to combine these drugs administered once a day. It can reduce the medication burden and it can increase the compliance in the patient to follow the medication. It will also reduce the recurrent hypoglycemic risk, which I'll explain later, and it can reduce the HbA1c levels of the patient. Now, what are the implications of recurrent mild hypoglycemia? Let's have a look. It can increase the risk of myocardial infarction. Cardiac arrhythmias, especially if hypoglycemia occurs at night or nocturnal hypoglycemia occurs, it can lead to death. Neurologically, the patient can experience behavioral changes, cognitive impairment, impaired memory, or even fall into a coma. Among the elderly, falls, incontinence, and depression are very common and are commonly exhibited. Now, that's all from us today. These are the references that we have referred to while presenting this case. Thank you very much for listening to our presentation, and I hope you have a great day.